Hello and welcome to Chapter 1A. We're going to be focusing on achieving health equity. Health equity, informed by the values of fairness and justice, is attainment of the optimal level of health for all people. Our society's evolving diversity brings with it an increased potential for false assumptions, misperceptions, unrecognized biases, discrimination, and stereotyping. We're going to look at important questions related to health equity, such as why has health equity become critical in America? How do the social determinants of health influence health disparities in America? How can your actions contribute to health equity? And what kinds of systemic changes support health for all? One of the first things we really need to define is what equality is. And so equality represents a situation in which all people experience inclusion, access to resources and opportunity regardless of their race, ethnicity, national origin, color, gender, sexual orientation, gender identity, age, religion, immigration status, mental or physical ability, and other areas of human difference. We also need to be aware of what health disparity really is, and it refers to a higher burden of illness, injury, disability, or mortality experienced by one group relative to another. A healthcare disparity typically refers to differences between groups in health insurance coverage, access to and use of care, and quality of care. So why has health equity become critical in the United States, in America? Well, the U.S. is one of the richest countries in the world, but is ranked lowest in health equity of the world's 11 wealthiest industrialized nations. So let me put some of this into perspective for you. Our first class meeting together, I told you guys briefly that I lived in India. While I was in India, I needed to go to the emergency room. I had an upper respiratory infection due to all of the pollution. My emergency room visit, seeing an ENT, ear, nose, and throat specialist, and 3 medications cost $9 US. If I were to make that same trip here to an emergency room, I wouldn't even get to see an ENT. But if I were to see an ENT and those 3 medications, we're talking about $5,000 roughly, right? That's just an estimate, but around $5,000. So we have things just a little bit backwards here. Health equity is attainment of the highest level of health for all. The World Health Organization defines health equity as the absence of avoidable or remediable differences among groups of people. The lower the personal income, the greater the chances are for being overweight or obese. Our country is a country of increasing diversity, and immigration is expected to continue to diversify the U.S. population throughout the 21st century. And health disparities results from an unequal distribution of social resources, from education to housing to jobs that provide adequate health insurance and a healthy living wage. America is diversifying in terms of ethnic background, age composition, self-identity, and religious identity. Our response to differences can lead to disparities in health. Any encounter with difference brings with it the potential for false assumptions. Stereotyping and othering can contribute to discrimination and other social injustices, trigger struggles for power and control, increase the threat of violence, and reduce every American's potential to thrive physically, emotionally, intellectually, and socially. So the graph gives us a projection of the percent of the total population from 2014 to 2060 and helps us to really identify why health equity is so important for our differences in populations and helping with the growth of diversity and different populations. So certain population groups are more vulnerable to health disparities. And disparities occur between populations and different subgroups within populations. There are also innumerable differences between people within groups. Certain populations tend to have higher levels of disease, disability, and death. For example, non-Hispanic Blacks tend to experience greater health disparities than non-Hispanic whites overall. So it's been identified by Healthy People 2020 that socioeconomic status, gender, age, mental health, cognitive, sensory, or physical ability, sexual orientation or gender identity, geographic location, or other characteristics are historically linked to discrimination or exclusion and vulnerability to health disparities. So going back to that definition of equality. Health disparities incur enormous costs. Racial and ethnic health disparities alone are estimated to cost the U.S. economy an estimated $35 billion in direct medical expenditures, $10 billion in lost productivity, and nearly $200 billion in premature deaths. When managed diseases or avoided through good health habits, costs are significantly reduced. This is being proactive with our health rather than reactive. Those who are not diagnosed and treated for chronic diseases add to the societal costs. Costs are related to treatment in the most costly type of medical facility, the emergency room department. I talked about that earlier. So if people don't have health insurance, if they don't have access to health insurance, if they don't have access to proper medical treatment, if they don't have preventive care, where do they go? They don't go to the doctor because that is truly a mindset of somebody living in poverty that we can't afford health. We can't afford to go to the doctor, so we don't go unless it's an emergency situation. When it becomes an emergency situation and we do go to the emergency room, our costs are quadrupled, if not more. I mean, I'm sure it's like 10 times more. So it's much more cost effective to go to a doctor than it is to go to an emergency room. Inadequate health education contributes to unprotected sex, tobacco use, and other risky health behaviors, which may diminish the workforce and or lower participation in the workforce. So we can't do better unless we know better. And guess what you're doing? You are doing better by being in this course. How do the social determinants of health influence health disparities in America? Indicators of health disparities are outcomes of a system that doesn't value individuals equally. Conditions that affect positively or negatively access to and distribution of health-related resources are known as the social determinants of health. Those include economic stability and educational attainment, social interactions and community context, neighborhood and built environment, which contribute to healthier lifestyles. Decades of research support a close association between poverty and poor health. Poor Americans are more likely to live in food deserts. And communities with low walkability, lower performing schools, poorer quality healthcare facilities, and higher levels of pollution and violence. Low education attainment also increases with increasing poverty. Poverty contributes to a number of different health problems with striking disparities in life expectancy. Levels of social support, social norms and attitudes, cultural influences, language barriers, and levels of literacy incarceration rates, and availability of community-based resources strongly influence our health and make up the social interactions and community context. Neighborhood characteristics, levels of industrial traffic and pollution, and exposure to neighborhood violence all contribute to health disparities and make up our neighborhood and built environment. I'd really like you guys to personally consider some social determinants of health. Consider some of your own biases. What terms are new for you? Have you heard of food deserts? Right? Did you know that there are some communities that do not have a grocery store? They don't have access. And even if they do have access, perhaps they don't have a vehicle to get there, and then it's not within walking distance. A large majority of communities that are impoverished don't have a grocery store. And what they have is a convenience store. Typically, they don't even have any fresh produce. How can we promote health across all of our communities if we are not offering access to healthy foods to all of our communities, right? There are systems in place, even in Chicago, that are community, like farms going into communities, like on a bus, right? To bring in fresh foods and fruits and produce, because it's really important. How do we keep people well if we're not giving them the things to keep them well? So not only are we limiting access to health care within the poverty-stricken communities, but now we're not even setting them up for success with healthy foods, access to healthy foods. So how do we maintain health if we don't have access to the things that make us healthy? So I really want you guys to consider that. Okay, so now that we've talked about everything that is wrong within, well, not everything, but a large portion of what's wrong with health equity in this country, let's talk about how you can make a difference, right? And how your actions can contribute to health equity. First and foremost, vote. Your voice matters. Get to know the people that are running in office for all elections. We're going to step into mindfulness, right? Use mindfulness to examine your own assumptions and biases. Cultivating mindfulness is a highly effective strategy for challenging the beliefs and attitudes that limit us. It helps us to raise awareness of unconscious biases, things we may not even be aware of. It increases your insights into the understanding of the unconscious aspects of other people's behavior. And it helps us to adopt a less us versus them approach to interactions with others, right? Let's affirm the benefits of diversity. Interacting with differences challenges your assumptions. It exposes you to new ideas, values, and experiences. And it really, really expands your world. The best thing I ever done, two best things in my life I've ever done is travel and living with people that are within that community. So when I lived in India, I lived with a family in India. When I went to Jamaica, I stayed with a Jamaican family. I believe in immersing myself in culture because that makes me a much richer person. Learn to communicate across differences. Effective communication across real and imagined differences involves the following, okay? Establish shared agreement about the values and goals of your communication. Pay attention to what is said and how it is said. Aim for full disclosure. Hitting pause when things get intense. Closing with dialogue about the dialogue. This is what I heard you say. This is how I feel about what happened. Really connecting with people who are different than you are, who think differently than you do, and who have different experiences than you do. Advocate for yourself and others. It helps to be able to recognize othering and discrimination when it happens, both to you and to others, right? Take action to protect your health and change your interactions in the future, right? Advocate for yourself and others. Training your brain to look for things that you have in common and the positive outcomes of diversity in our world, right? We are going to have a lot of differences with a lot of different people in the world, but I can guarantee you, at the core, you will find some commonality. Seek it out. I really want to encourage all of you to take a look at Project Implicit. It was founded in 1998 by 3 scientists at Harvard, and it's a nonprofit organization and international collaboration between those researchers who are interested in implicit social cognition, thoughts and feelings outside of conscious awareness and control. The goal is to educate the public about hidden biases and to provide a virtual laboratory for collecting data on the internet. You guys, it's really interesting just to see what are your own biases. I was pretty shocked by some of the findings when I did this. And I think it's good to keep yourself in check, right? Again, without judgment, not getting down on yourself when you see like, oh my gosh, I do have bias. We all do. But it's when we're aware of it that we can do something about it, right? And understand it more. So I encourage you to go and take a look at this website and check out some of your own personal bias. How can systemic change lead to health for all? Well, public health experts propose the following to achieve a more equitable distribution of healthcare. Increase access to healthcare. Seems like a no-brainer. Increase minority providers. Increase diversity training. Increase preventative services. And expand healthcare insurance. So reducing the social determinants that could contribute to health disparities, and some of those specific changes to reduce those social determinants. Construction of affordable housing, remediating sources of pollution, increasing neighborhood walkability, being able to walk to a grocery store or to get fresh food, produce, establishing after-school programs. So many people have to work 2 jobs just to make ends meet. What do we do with the kiddos? Building community gardens, right? The hippie in me says, why doesn't everybody's front yard have a garden instead of grass? Because then we could feed everyone. And then facilitating meetings between community and law enforcement to have collaboration, right? The more we collaborate, the more we connect and communicate. Communication drives connection. Lack of communication drives disconnection. So some of the examples of initiatives to increase health for all national initiatives to increase health include Health People, the creation of the U.S. Department of Health and Human Services, Task Force on Black and Minority Health, and new reports on health disparities from the Surgeon General. City, county, and state initiatives include improvements in standards for public housing and construction, changes to zoning ordinances, support for public transportation, policies to increase the minimum wage, and others, and including in there too the advanced walkable neighborhoods. Colleges provide unique opportunities for students to develop more healthful habits. The implementation of this course, for one, So there's also the student health center, healthy meal options, fitness facilities, security services. I would like you to kind of look in what other programs are offered here on campus. Be mindful of health equity. How are you contributing to your community? What changes do you think should be made? Look forward to talking about this more in class. Take care of you.